Can we do it?
Welcome back, everyone, to In Between Sessions, beyond the walls of the therapy office. I'm your host, Samantha Hill, and I'm glad you're listening today. Our goal with this show is to break down mental health topics in a way that's approachable, relatable, and informative. Whether you're navigating your own journey, supporting someone you care about, or just curious about how our minds work, we want to create a space where open discussion about mental health can be made while breaking the stigmas. First, let's start with a warm-up. When you think about therapy, what is the first thing that comes to your mind? Got it? Did you think of speaking to someone about your problems? What about sitting or lying on a couch while they quickly jot down notes on a clipboard? Maybe you're thinking about a conversation or how to respond to, and how did that make you feel? Or did you think about the relief of talking about your stressful week? What about the conversation of accomplishments that you've completed in this past year? Did you think about that comfortable couch that you sat on while you told your counselor that you just got a promotion? Therapy can be uplifting or it can be stressful for some. But today, we're breaking down the different types of common therapy approaches along with what a typical therapy session may look like. Now, hold on to those initial thoughts about therapy and see if your perspective has changed by the end of this episode. So let's dive more specifically into what therapy is. Most people have experienced a therapy session, some people haven't, and that's totally okay. No harm, no shame, no foul. But we're going to break it down a little bit more and maybe inform you, if you've already been to therapy, about some aspects that you didn't know about. When we talk about psychotherapy, sometimes you'll hear it be called or referred to as talk therapy. We're really talking about having a safe space to slow down and explore what's going on beneath the surface level. It's a process that helps people make sense of their emotions, their thoughts, and their behaviors, and then figure out ways or changes that might help them or benefit them. For a lot of people, therapy helps uncover the why behind what they're feeling. There's deeper roots that can include past experiences, patterns, thoughts, or beliefs, often shape how we cope, how we relate to others, and how we move through the world. And once those pieces start to make sense, that's when real healing and real change can begin. People come to therapy for all kinds of reasons. Sometimes it's because of a stressful life event, trauma, medical diagnosis, or a major loss, like losing someone you love or you're close to. And other times it's to get support for ongoing mental health concerns, just like anxiety or depression. One thing that's important to understand is that therapists and counselors aren't just there to listen. They have years of specialized education, training, and experience. And the therapy goes beyond just talking. A therapist is trained to notice patterns and thoughts and behaviors that even the people closest to you might miss, or that you may not even recognize in yourself. Another big part of therapy is trust. You can be honest with your therapist without the fear of judgment. The relationship is built on confidentiality, meaning what you share stays private with a few important exceptions, like the risk of harm to yourself or to someone else. It's also helpful to know that therapy isn't one size fits all. For some people, therapy is short-term, which may take a few weeks or months, and can be focused on navigating a specific challenge or overcoming something. For others, it can be a long-term process that can last up to months or even years, especially when they're working through more deep and complex issues. No matter how long therapy lasts, the goal is always the same: to support, understand, and help people live healthier and more balanced lives. So we just laid down the base of, what it is, but how does it work? And, we mentioned earlier in the beginning of this episode of the different modalities that therapy can take, the different approaches that it can be used in during a therapy session, but we're just going to break down a few of them. And the main one today we're going to be talking about is cognitive behavioral therapy, which is the most basic and common therapy approach, and what most counselors do use here at Wilmington Mental Health. So what does research actually say about therapy? And the good news is that it works for most people. Studies show that the majority of individuals who go to psychotherapy experience a level of symptom relief or are able to function better in their day-to-day lives. In fact, according to the American Psychological Association, about 75% of people who start therapy see some benefit from it. And therapy isn't just talking it out either. Research shows that psychotherapy can improve the emotional and psychological well-being and is even linked to positive changes in both the brain and the body. Isn't that crazy to think about? The brain and the body. So what's happening in therapy can actually create real measurable change, not just emotionally, but physically as well. During psychotherapy, a counselor, therapist, or psychologist uses evidence-based approaches, meaning these methods are backed up by science, to help people build healthier ways of coping, thinking, and responding to life. And there are many, I mean many, different types of therapy. For example, like cognitive behavioral therapy that I mentioned earlier, interpersonal therapy, and other forms of talk therapy. And each approach is designed to help individuals work through challenges in a way that fits their needs. The key takeaway? Therapy is a collaborative, research-supported process that helps people feel better, function better, and build skills that they can use long after the session ends. Today, our guest is Joseph Rengifo. He's going to talk more about what CBT is, what a typical therapy session may look like, in addition to different approaches. So stick around to hear more. Hey, Joseph, how are you?
Hey, good. Thank you for inviting me again.
Of course. Did you just come from a session?
I did. I just finished one.
Perfect.
Yeah.
And what was the general overview of your session today?
Well, one of those where patient comes in, presents a case. I go over, solutions. In this particular case, it was a solution-focused session, and review homework, review, how things that are presenting that were not presented last time, how they incorporate part of, she or he the person incorporated the work we have been doing, and how they're planning to incorporate that in the next few days until we meet again.
Perfect. So one of my questions I have for you today, have you used any type approaches during your therapy sessions today that that may be your favorite or your best way to approach?
Yeah, so I just mentioned solution focus, but more often I focus on cognitive behavioral therapy. And what CBT is about is primarily a therapeutic approach in which the clinician helps the patient make connections between thoughts, feelings, or emotions, and finally behavior. So we have two names for each. So thoughts of ideas that come up to you, emotions or feelings that are connected or follow, sometimes simultaneously, sometimes happen, they happen after or as consequence of, and then finally behaviors or actions. So the connection between the three of them is basically the premise of cognitive behavioral therapy. Is helping individuals, patients come in, see how those three things are interconnected, and how changing one can affect the other. And obviously, there are debates in terms of which come first. Do we have thoughts first, and then feelings, then actions? And consensus is that things can happen either simultaneously or in response to something else. Just to give an example, right now, you might be thinking about the words that I'm saying, but if I go and tell you to think about apples, your brain most likely takes you to picture an apple. You're not going to just completely ignore me unless I'm, I don't, you don't really care about me or whatever. You're not going to think about that. But if I just mention the word apple, it will be almost impossible for you to completely ignore what I said and not picture an apple in your head. That's the thought. So I trigger you to think of an apple. Now, that thinking process is followed by a feeling that your brain connects. By thinking, your brain somehow finds in that area of the brain where we process feelings, connects that image to a feeling. And let's say the feeling is yummy. I'm hungry. I want an apple. You're gonna feel good. Maybe you're going to feel like I'm hungry. You're going to feel that you might want to go on buy an apple tonight. Or potentially, I had a reaction to an apple in the past, so I don't want an apple. But if the feeling is, haven't eaten apple for a while, so I might get one tonight, or something along the line of that, the next thing will be an action: buying, purchasing, going to grab one from your refrigerator, basically eating it. That's the action part.
So is that the behavior?
That will be the behavioral component of it. Now, there are many things related to CBT that make it more complex. It's not a simple ABC type of thing where you think you feel and then you act. There are many components, and those are things that I review with the patient during the session.
Gotcha. So let's do a hypothetical run through real quick. I come in and let's just say I'm dealing with a lot of stress in my life. And I'm in school and I work a job. And I come to you and I'm like, gosh, I have so much stress. How would you implement the CBT process to me to maybe, help figure out to like maybe change something like a coping strategy?
Right.
So in a hypothetical scenario, what are some questions that you would ask me that would get me to start thinking about maybe the source of my stress?
Yes. So, thank you for that question. So basically, the process in my particular case, each provider can potentially adjust and adapt things a little bit. But in my training, one of the things that we were exposed to as counselors in the class, and what my professors basically taught me, that I later found to align with my philosophy, or basically I started using it easily and adopting it, was that people come to you with a set of preconceived thoughts and preconceived notions, right? Preconceived beliefs. And I used to call, in the session, I call them belief systems. And in our belief system, we have those. It's kind of like a bank of knowledge, bank of ideas that are already there that your brain is going to pull from. So when I mention apple, your brain had to go and access that part of the brain where you had an apple, right? So I tell the patient, I want you to start thinking about those belief systems, but it's just really hard to think about belief system and grasp, but that idea, I kind of navigate the process of, the thought process, or the picture that I draw, or the images that I draw, is basically a square or graph where I put first thinking or thoughts, then feelings, then behaviors. But on top of it, I put belief system as the reference point. And using that same analogy of a bank of information, I tell them, over time you acquire principle, morals, virtues, things that you acquire over the years, and that you grasp and made them personal, or that you follow because they connect to the social standards in the country you live, in the region you live, in the family you're from. And basically, if, let's say, the idea is robbing or stealing, that's your belief, not to do that, basically something you endorse. If you go and tell me, I'm under stress because I don't have money, therefore I should go, the solution will be go and rob a bank. But if in your belief system that's not something you endorse, then that's not a possibility. That's not something you're going to be thinking of. That's not a concept you're going to hold with you. However, if you endorse that, if you somehow endorse the idea that maybe when something goes wrong, maybe you have you should go and take from somebody else or from something, then that is going to be one of your beliefs and potentially one of the actions you're going to engage in. So my approach, my psychotherapeutic approach, is I slowly show you how your thoughts become a feeling, or how they develop into feelings. So and then I kind of like do a reverse engineering type of thing, where we start thinking about the emotion. So you tell me that you're feeling anxious right now. So I go back and I say, okay, let's try to think where that comes from. When I ask them what's going on in your life, what has been happening recently. Maybe we talk about childhood stuff, or relationship, or basically we try to link that feeling to thoughts the person has been having, situations they're having in. And that's another thing. The situation is a significant thing. Right now, the example I used previously, the situation was me bringing up an apple. That was the situation. Before that situation, you probably had an apple, the image of an apple in your brain somewhere. But that was not probably, unless I was really lucky and I asked you that question at the same exact time that you were thinking about it. Most likely, the idea of image of an apple was somewhere stored in your brain, but you were not really accessing that or thinking about it at the moment. The event or situation, me asking you or me telling you to think about an apple, triggered the thought, and that your brain based on the information that you have stored somewhere in your brain. The trigger, the words that I use trigger through your hearing, trigger the thinking of an apple, and then the image presented, and then that follows into feeling a certain way, and potentially later it will lead to you doing something about it, whether that is going to the supermarket and buying one, or your house grabbing one from your refrigerator or basket or whatever.
So that's where maybe the phrase talk therapy comes into play here, is because in this situation, we're sitting down and talking about apples, and we're just simply talking about them. But then we are just talking about like a red apple, for example. And then we start talking about green apples. And then green apples can elicit some type of feeling from me.
Right.
So that's where I guess the approach of talk therapy comes in.
Yeah.
Do you find it to be beneficial for people to, maybe even like write about it, talk about it? Like,
Right.
what is the best way that you find that helps those who come in who are wanting to, like, anxiety, depression, or stress, financial matters, or anything?
Well, first of all, I think I prefer not to use the word talk therapy, because you just mentioned in the same sentence, I asked the patient to go and journal what they're what they're thinking, what's happening. Is that talk therapy, or is that thinking
No.
more like introspective therapy? You see
Yeah.
what I'm saying?
Yeah.
So I prefer the word psychotherapy.
Okay.
I call myself a psychotherapist rather than a talk therapist, because talk is more like something you do on a daily basis. It doesn't necessarily require or involve thinking or critical thinking or logical thinking. In a counseling session, it's almost certain that you're going to have some type of introspective thinking, logical thinking, unless you go in a session with someone who you have known for so long, and the relationship has become friend-like.
Okay.
You're talking to them about what's going on daily. However, at some point, you can say, well, I'm going to try to make that session a productive one. Or even if you're pretending to be smart, the counselor somehow is going to have to challenge whatever you're saying, or repeat with some type of introspective approach, right? So let's think about what you just said, and repeat it. So is that just talking, or is that an
Yeah.
approach that deserves a different name? You see what I'm saying?
Yeah.
Yeah.
Is that where, like, the classic question of, like, well, how does this make you feel?
Correct.
Well, how does that make
Exactly,
you feel?
because do you ask that to your friend? When you talk to
No.
your friend, that's talking. You're talking.
Yeah.
But do you go and do you have any training as a talker? As a person who talks to others, do you have any training in terms of, you are telling me something, we're talking, but then I use that information and I connect it to ideas, thoughts, approaches, methods that I have learned in school, or throughout my education, and I say this is the right approach, or this is potentially a good approach that I should use to respond to what the person said. So it requires more analytical processes than just talking. I'm not saying that talking doesn't mean that you're analyzing and you're being logical, but because there is a method behind. It's not just free talking. It's not freely, coming up with ideas and sharing that with another person. There's more a methodology behind it, and I think it deserves a different name, basically, as simple as
Gotcha.
that. However, some people do think that free speech, like a free talking, basically you come in, and in some situations, I can think of an example right now, but let's say traumatic experiences, or even substance use disorder. Depending on the situation, I can choose to let you talk freely. So you come in and you're like, okay, tell me everything that's in your mind freely. Just throw that out.
Yeah.
And that can potentially be a type of talk therapy, just talking. We call that narrative therapy, right? Or reality therapy in some cases. But these things have names, different names, rather than talk therapy.
Yeah. So talk therapy is just like a umbrella name
Correct.
for all of these little subcategories that fall underneath that.
Correct.
That's good to clarify.
In my approach to using cognitive behavioral therapy, I also incorporate this extra step. So we do a couple of things. We do Socratic questioning,
What's Socratic
where
questioning?
Socratic question is basically structural questions that are not necessarily yes and no ended. So they're not yes and no questions. It's more like an open-ended question.
Okay.
And but they Socrates was basically a philosopher, right? So he asked questions that will make you think.
Yeah.
And that is what I mean by introspective thinking, right? So and it doesn't have to be like, you're thinking about the past, but you like the question now, how much you deserve, like thinking to think. But in the process, besides Socratic questioning, motivational interviewing, which is basically challenging the person's status quo and ask them to kind of consider potential change by using motivation. But the most important thing besides the CBT main components, which is connecting thoughts, feelings, and behaviors, perhaps is to help the person see how their thoughts can become at times, or can be at times, or almost actually in every single situation, can have different versions of it, and they can become maladaptive.
Can you give an example of that?
Yes. So right now, this is probably the most common example I give in my sessions. Today, I go to work, and I'm thinking, I'm doing the same thing, my routine, go to work, do my thing, and then finish my work and go home. Well, today my boss comes to me at some point during the day and tells me he wants to talk to me. Well, in the process, let's say he says that to me at 3 p.m. and I work until 5. Well, in the next 2 hours, I'm going to be thinking nonstop, what the heck does he want to talk to me about? Like, what is going on here? What I could be, unless I know for sure what's going to happen because of what's happening with the company. Maybe my coworker told me that he talked to my boss yesterday, and it was about, I don't know, a change the company's going through. But depending on what I'm reading from my boss, maybe I'm thinking I've been coming late lately, or I didn't come to work yesterday, or something happened recently, or maybe my performance is not good. I'm going to be concerned, right? And being concerned is a feeling. But that feeling of being concerned obviously is the result of thoughts that I'm having. Maybe the thoughts are, am I going to be fired? Am I going to be fired? Does it mean that my boss is angry at something that I did and he wants to tell me that he's going to fire me? So to make it quick, basically today I get fired. That's what's happening. I get fired, and that is the situation, right? The situation, going back with the examples we are presenting. So the situation is, my boss tells me I am fired. Before that, I just mentioned that I have millions of thoughts coming up to me and making me feel a certain way. But right in front of my boss, when I'm being told I'm fired, my thoughts go into survival mode. What's going to happen? Like, how am I going to pay rent? And it's or depending on my personal situation, maybe I have been thinking about, I need another job lately. So this is going to be taken into, finally, I'm out of this. Finally, I can get another job later. But for the most part, the majority of people, regardless of your situation, being fired is going to trigger specific thoughts of, feeling confused, at a loss, feeling, you're gonna have to put things together, because it's not easy to be coming to work today, thinking that you have a job, that you have security, and then being told that you're fired. So my thoughts are going to be, some people like to call them negative and positive, but sometimes we go into specific thought modes or thought processes, and these thought processes could be focusing on, let's say, the negatives, right? So my boss told me I am fired. My thoughts are, I'm lost. I'm going to die, or I'm not going to be able to pay rent. How am I going to tell my wife? This week is going to be horrible for me. So I jump into these conclusions. So that's one of them. A cognitive error that we usually often engage in is cognitive errors. It's jump into conclusion. So I jump to the conclusion that being fired puts me in a situation where I'm not going to be able to get a job. It's going to be impossible. I can catastrophize the situation. That's another one. Catastrophize the situation is I won't be able to pay rent. My wife is gonna kick me out. I will lose everything because I
Mm-hmm.
lost my job. I won't be able to get a job ever again. You can also do discounting the positive. Discounting the positive manifests in this way. I have gotten jobs many times. I've been fired or lost a job or switched to another job, and within a certain time frame, I get another job. Discounting the positive in this case would be I start thinking about the times that I lost a job and had a hard time finding a job, and discount the times that I lost the job and I found a job right away, like quickly, or it was easy for me to do it, that I didn't have to be challenged by that. And I think there is an evolutionary response to that, or there is a revolutionary explanation. We want to stay with the negative, with the bad things, with the things that are going to, we need to be cautious.
Mm-hmm.
If I go and think, oh, I can get a job tomorrow, it's going to be fine. That can be deceitful and dangerous because it could potentially be difficult. So if I stay on the negative, if I stay on the possibility that I might not get a job, that things are going to be rough and hard, that helps me prepare for the future. But if I go on and say to myself, you know, oh wow, and I stay on that negative thinking for too long, then that maladaptive thinking pattern can manifest into negative feelings or adverse feelings and adverse behaviors. And then you asked me for my approach to therapy, to
Mm-hmm.
CBT teaching. I draw in the chart. I put a column will be thoughts, or thinking. Another column will be feelings, and another column will be behaviors. And then I add signs. So because people tend to think of them in terms of like negative and positive.
Mm-hmm.
So if the thought is positive and the feeling is positive, there's a high chance that the outcome, which is the behavior, is going to be positive. However, if the thought is negative, the feeling is negative, there's a high chance that the behavior
It's
is
like
going
an
to be negative.
equation.
It's an equation, it's a math
Okay.
equation. What happened if the thought is positive, the feeling is negative? Just like, it's kind of
Mm-hmm.
difficult to imagine something like that. But let's say that were to
Mm-hmm.
happen. I'm thinking, this sucks. I'm not going to be able to get a job. But I'm somehow feeling good. Maybe because deep inside
Mm-hmm.
I'm feeling good because I'm not gonna have to come to work every day, and I'm gonna
Mm-hmm.
be able to stay in bed until late. But I'm not somehow thinking that way. I'm thinking it's gonna be hard, but I'm feeling good. Well, I like to think that in the equation, depending on which one is stronger,
Mm.
the outcome will be either positive or negative. That is my own method that I use. I wasn't taught that in school. I just came up, figure it out basically over time that, it kind of represents this way. It manifests that way in real life many times. And I tell them, if you're feeding your head with more maladaptive thoughts, with more cognitive errors, which is not to we are not to demonize cognitive errors. It's just the way we do things, right?
It's a
That's our
human
human
thing.
thing.
Yeah.
Because we have that reality, I want them to become aware of them.
Mm-hmm.
And I ask them, and in the process, and this is kind of jumping the fence a little bit because I don't do that in the same session. I
Yeah.
tell them, go home, write down all these thoughts that the homework could be, go home and every day identify a situation,
Mm-hmm.
write down the thought, write down the feelings, how you felt at that moment, and what did you do. And they have to do that every day. And the idea is that we do this every day no matter what.
Mm-hmm.
It's a common thing. It's a thing that we do every second basically in our life. However, knowing how to do it, becoming aware of the process, identifying cognitive errors, help us uh, during specific situations to really, challenge our thoughts, challenge our feelings, challenge our behaviors, and modify them.
So is it like a subconscious practice of mindfulness, but like you're being mindful of your own like thoughts, behaviors, and emotions, and that you're slowly like, especially if you're listing them out, you can see like the pattern of like what one is feeling. So is that where like CBT and like the personal reflection and like the process of therapy, like is that how it works basically?
Yes, I mean, you use the word mindfulness, and mindfulness is basically becoming aware of the thing you have in
Mm-hmm.
front of you or present, and then somehow, pushing away the noise, right?
Mm-hmm.
Well, if you're able to identify the thought that is negative,
Mm-hmm.
and then disregard all the other things that you're thinking, not necessarily disregard, but kind of like focus on that thought at the moment and analyze that thought, then you're being mindful because you're really spending time
Mm-hmm.
on that thought, and it helps you analyze it, review it, work on it. And I think in the sessions, or as the homeworks that I present, it invites them to do that. And we can master that over time. The
Mm-hmm.
more you train on this, the more you are able to identify these things easily and then respond to them. But many times we do this in auto mode. It's
Yeah.
just automatic, and we just don't do anything about it. We let the brain to go in auto drive or whatever,
Autopilot.
autopilot, in
Yeah.
autopilot. And basically, we want to be in the front seat and actually,
Mm-hmm.
manage it rather than let it do what it does. And it's not that we have a tendency to be negative, but we have a tendency to protect ourselves.
Yeah.
And I just mentioned protecting ourselves means, let me pay attention to how bad it could go
Mm-hmm.
so that I can prepare for it. Could it be that we can be positivist, and something presents and then we go and take that in a positive way and we're happy about it or
Mm-hmm.
whatever? Sure, many people are like that. Many people somehow manage to, they get something, they're told something, like you're fired, and they go with a happy face and say goodbye to everybody and take their stuff and then walk out, and they're like, it's kind of like in happy or la la
Mm-hmm.
land that everything is going to be fine. And tomorrow they work on their resume, and a week has passed, they haven't been able to land a job. Yeah, so this is basically, you want that, but you don't want to be completely oblivious to the severity of the situation, the I'm looking for the right word, the intensity, or the you know the severity of the situation that has been presented. You lost your job, and unless you have a really good backup, mom pays for everything,
Mm-hmm.
or your husband told you go and get a job as a leisure, or just for fun. But if you are depending on this and that's your attitude, everything is going to be fine.
Mm-hmm.
That can help you get another job, because obviously we want a positive attitude to be able to go and get another job. But too much of it can be hurtful, and then could be maladaptive too, because you're
Mm-hmm.
avoiding, you're ignoring, and staying on the everything is going to be fine. So we call that mental filtering, another one of those cognitive distortions. In this case, you're focusing too much on the positive, and then disregarding the negative,
Mm.
the possibility that you won't be able to get a job. But there are many of them. There are about 50 or plus, right? So cognitive biases, we call them. We have different names. Cognitive biases, thought errors, cognitive distortions. Is basically how our brain sometimes is biased and favors a certain way of thinking, and sometimes disregard other ways, when we should think about both almost the same way.
Mm-hmm.
And it actually happens. Studies have demonstrated we have about, I think it's about 60,000 thoughts a day, maybe more. But out of those 60,000 thoughts, we like to think that 30,000, or half of them, align with good things, and the other half aligns with bad things.
Mm.
But in the process, we give more weight to the bad things, right?
Mm-hmm.
Because they present us with information that can protect us for survival purposes.
Um, so the last question I have is, if you could sum psychotherapy up to someone who may be hesitant to approaching, um, you know, just approaching like their first session, or to keep going, what would you tell them?
So earlier, as I mentioned that one of the approaches I use is called motivational interviewing.
Mm-hmm.
Um, Some people might think of motivational interviewing as a manipulating approach, but it's not. It's really helping the person to think. Right now, you're coming to the session thinking that this is not what you want. Well, your brain is somehow hesitant
Hmm.
because your mental health condition or your emotional state or psychological state is already rejecting things, right? You don't want to be here.
So, what kind of questions would you ask? Like, you would ask your client during a motivational interview and just like spit out a few of them
You know,
to refer back if I lost my job, for
mhm.
example.
You ask again Socratic question.
Hmm.
Socratic questioning is one of the things we use. Sometimes we ask them to kind of like think about how likely it is that they won't get a job. But basically, we could potentially go on weigh possibilities versus actual
Hmm.
risks. Let's talk about what is that, and this could be entering a little bit into the solution focused terrain, but
Hmm.
basically, I could potentially ask them. So tell me, you lost your job, right? But do you know anybody who might own a business, or
Mm-hmm.
have you gotten any offers, any job offers recently, or what do you like to do? All I do is this. Do you have any other trade, any other any other skill? Let's say you're not able to get a job in the same field that you're working on. Will you be willing to work for McDonald's?
Hmm.
It doesn't mean you're going to get a job at McDonald's tomorrow, but it's kind of like pretty easy sometimes to get a job in certain places, as long as you're able to bring down your expectations and get a lower pay rate, right? Motivating the person is kind of like going and asking them, don't give up or don't stay stuck on
Hmm.
something, is motivating them to see that perhaps if they're stuck on this mindset, on this idea, maybe changing that approach, which is key here. Change is the key word in motivational interviewing, is changing the way their perspective and potentially focus on other possibilities, alternatives. And
Hmm.
that is another key component here. Change, focus on alternatives, consider alternatives, and let's challenge that rigidity or mental rigidity where you're like, it got to be this way, it has to be this way, I'm going to do it this way, because you might not be able to repeat or reproduce the same exact thing you have now. So I was working for, I don't know, let's say I was working for Google as a executive of whatever, and there's not two Googles in the world, right? It's only one
Hmm.
Google. So how do you repeat? How do you make that? How do you repeat that? How do you make that exactly as you have it, as you had it, when there are not two of them?
Hmm.
And perhaps what that might look like is you applied for a job at Microsoft.
Hmm.
Well, Microsoft sucks. I don't want to work for Microsoft. Well, you know, can you somehow bring yourself down to a lower level and think that perhaps by doing so, and this is another approach. It's called acceptance and commitment therapy. You accept that you lost a job, and you're able to say, okay, well, I'm going to have to accept a job at Microsoft, but in the process, you put yourself in this open-minded, in open-mindedness, and then you potentially go and apply and land a job at Microsoft, and then maybe and only maybe by being positive and having an open mind,
Hmm.
you end up being in a better situation than you were before because your mind is open to the alternative, right?
Hmm.
And you have accepted the fate of having lost your job at Google, basically.
So it's all very intricated but intertwined.
Yes,
And it's
correct.
never going to be one specific thing. It's all going to be a play. So you might be doing three things at one time, but you're never going to be
Correct.
doing one thing at one time.
Correct. I mean, I could potentially make a session just about CBT,
Hmm.
especially because I have to train you. That first day that I introduce CBT, It might be that during the next 60 minutes or 53 minutes, usually a session can be 53 minutes, 60 minutes, or 45 minutes, or half an hour. I decide that, you know, I want you to really understand it, digest it, really process it. You know, if I jump into giving you 25 different things at the same time, that might be too much. But some people might need that later on,
Yeah.
because they bring 5 different topics, and I could potentially say, well, you know, let's not do that. Let's stay on one thing at a time, and I'm training them to do that, and it's important that I help them to do that. But at times you go with the flow, and you know, the person somehow guides the process and tells me what they need, and you know, depending on what they're presenting, I can present solution. I can sometimes combine things, so I can be in a session, I can start with mindfulness, and then I tell them, you know, that's going to be a step 1, then CBT is going to be a step 2, then potentially ACT is going to be a step 3, and then solution focused therapy is going to be a step 4. Not that you're like doing them one after the other, but I teach them all maybe in one session, where the person might be saying, you know, what do I do with this? How do I respond to this? You know, but there are situations like in phobias where all I don't use CBT or any of that at times. Maybe at the beginning, but I focus only on progressive exposure therapy, and that's all I do for that. And you know, that's in itself a whole long conversation, and explaining what it is. But basically, yeah, it could be guided by the situation, the severity of the symptoms, and so on and so forth.
Thank you so much for coming in between our sessions today.
Yeah. I gotta go and jump to the next one.
Yeah. We thank Joseph today for coming on today's episode of In Between Sessions to tell us a little bit more about his approach to therapy, as well as insight to cognitive behavioral therapy and different approaches. As we wrap up today, I want to leave you with this. Therapy isn't a sign that something is wrong with you. It's a sign that you're simply just a human being. For too long, there's been a stigma around therapy that has told us to stay quiet, to tough it out, or to believe that we could just handle everything on our own, but that's simply not true. Real strength shows up when you're willing to look inward, ask for the proper support, and to simply start honest conversations about our mental health. The more we openly talk about therapy, the more we normalize it. And when we normalize it, we make a space for healing, just simply not for ourselves, but for our families, our friends, and our communities. So whether you're in therapy, thinking about it, or just learning more, know this. Seeking help is not a weakness. It's a powerful step towards understanding yourself and living a healthier and more connected life. I'd like to thank you for being a part of this conversation today, and let's keep challenging the stigma with one honest conversation at a time. Would you like to start therapy today? Contact Wilmington Mental Health. Give us a call at 910-777-5575 or visit us on our website at www.wilmingtonmentalhealth.com today.